Good morning, everyone. How are y'all doing? Can you hear me okay in the back? Yes. All right, excellent. My name is Stan Collins. Nice to see you all. Thank you for coming to our workshop. I am excited to be presenting with Ellie. And so we're gonna work through all things messaging. I do want to give a disclaimer right here at the top, though, that this is not a how to work with media workshop. This is not 90 minutes of working with media. This is messaging. We will touch on that a bit. But that is not the heart and soul of this presentation. So I mentioned earlier, and hopefully most of you are aware, but I work with Know the Science, which is a branch of Each Mind Matters, funded by Cal Mesa, so funded by county behavioral health agencies. Basically, there's a variety of projects we have that it just made sense to pool our money and pool our efforts together. So if you're not familiar with Cal Mesa, it's all created out of Prop 63 from a few years back. And again, it's just county behavioral health agencies realizing that it made sense to collaborate, especially on these two projects, Know the Signs, Each Mind Matters. There's a few other directing changes that are under the umbrella. In case you're not familiar with Each Mind Matters, though, eachmindmatters.org is the English language website. Sanamente.org is the Spanish language version. It is a play on words, living, mind healthfully. But Each Mind Matters is California's mental health movement. You're seeing a lot of lime green here today, and we have embraced this as the symbol of our organization, or as our commitment. And it is not saying that we are the only ones. What we are trying to do is bring all the voices together, all the people who have been working on mental health for years and years, realizing that we'll be more powerful as a unified front. Now, a branch of that is the Know the Signs campaign, with three goals in mind, is that we want people to know the signs, find the words, and reach out for support. So Suicide Preventable is preventable.org is the English language version of that website. I would encourage you to go and visit. Look at if you go down to the reach out section, you can see the Los Angeles County resources. But through a RAND Corporation survey, we found that 50% of people in California were exposed, and we've gotten pretty hard marks on the resources and materials that we've created. We're going to circle back to some of the resources towards the end of the presentation. But for now, I'm going to introduce Ellie Stout, as you all just heard, Director of the Suicide Prevention Resource Center. And I think you have some disclaimer language you need to say.
Am I on? Okay, great. Just also for this presentation, nothing I say reflects the views or opinions of SAMHSA, the Substance Abuse and Mental Health Services Administration, which is our funder. And I think I have another. Oh, and just a reminder that we are the nation's resource center. I think I plugged our website adequately if you were in the keynote session, but I do encourage you to go to our homepage and sign up for the weekly Spark newsletter. And we also have a lot of resources around messaging, one of which we were gonna print for this session and didn't happen. So we'll follow up with you with a specific resource that will be helpful for you and your messaging.
Yeah, we know everybody that signed up for this individual workshop, but we'll probably be getting those all handouts out to all people, because hopefully you're going to go back and watch some of the other workshops that you're not going to be able to see today. So with that, we had a pretty lively, interesting conversation just now about language and how language is important. So many of you are familiar already with the term that we're trying to get away in the suicide prevention community, away from that term committed. But again, these are the words we use, and we have to be authentic, as Melvin pointed out. But we're trying to get away from those terms for a few reasons. For one, a lot of people are shocked to find out it used to be illegal in most states to attempt suicide. It no longer is, fortunately, but it's a reminder of how far, or how not that far removed from the dark ages we were. But the one that I actually get more held up on is this one here, the successful versus an unsuccessful attempt. Because if somebody successfully attempted suicide, obviously they're no longer alive. If they were unsuccessful, they lived. But it's more just about adding clarity to, just clarify, remove the coloring, remove the ability to bias these words. It's either a death by suicide or attempted suicide. But when we're talking about how language matters, it can't just refer to those two components. We really have to hold ourselves accountable, those in our groups, in our communities, that it has to extend into mental health and other areas. Someone is not bipolar. They have a diagnosis of bipolar. Someone is not depressed. They have depression. It is not all that defines us. Describing behaviors as opposed to a cry for help or manipulation or something. So again, we just need to be cognizant that the words that we use shape people. And some people, when it comes to the individual conversations, one of the things that even more than any of these, is how many jokes there are out there about suicide. On television and our conversations, those people will say, oh, KYS, KMS, which is a text abbreviation for kill myself, kill yourself. Oh, if that person should just kill themselves. And in those intimate conversations, pausing and not just letting it slide by the wayside because we've gotten so used to it, and having a conversation and say, hey, I've lost a number of people in my life to suicide, and I just want to go back. You just made a kind of a slide joke about suicide. I just want to let you know that when you say that, I'm going to take that seriously. Are you thinking about suicide? And just calling people, because I think so many of us make these comments without even realizing that we're doing it. So I think some of the most important conversations we can have about terminology are the individual ones that we have. But again, just other things we can do to frame. So I kind of did this, I kind of gave away this wonderful analogy that I have. But what are the causes of suicide? This is the interactive part of the presentation. What are the causes of suicide?
Depression.
Depression, mental illness. All right, what else? Hopelessness. All right.
Substance abuse.
Major life changes, traumatic events, financial issues, trauma, pain. Nobody's going to say bullying. I'm surprised. Bullying. Thank you. And I would say that pain and hopelessness are probably closest to the answer. But a lot of times when we talk about causes of suicide, we use this term. Well, it was depression, it was mental illness, it was the breakup, it was the job loss, it was this or it was that. We try to oversimplify suicide. And I think we do that because we want to be able to fit it in a box, put a bow on it, and put it on a shelf so that we can understand it better. But suicide is rarely, if ever, caused by one event. I mentioned earlier that idea of this Jenga game, where we blame that last block that gets pulled out, and that's what causes the whole tower to fall. But in reality, if those other blocks had been in place, that one block probably would not have had that impact, that job loss, that financial issue, that breakup. And so, the definition of cause is a reason or an action. If I hold this piece of paper up and I drop it, and you could say that I caused it to fall. So it falling is an inevitable outcome. When we say that bullying, being LGBTQ, being a veteran, going through a breakup causes suicide, we're inadvertently kind of normalizing that suicide is an automatic or caused response to that event, and that's not the case. Most kids who get bullied don't think about suicide. Most people will go through a breakup or divorce, not think about suicide. Most people with a mental illness, with a diagnosable mental illness, will not think about suicide. And so we have to be very careful with this. And if you're not familiar with these two terms, Virtue effect versus Papageno. And the Virtue effect is based on a book called The Sorrows of Young Virtue that was back in, I want to say, the 1800s in Germany. And as that book circulated through Germany, the main character in it dies by suicide, young man in his 20s. And what they found is that there was an increase in suicides. And a lot of times, young men who identified with the main character would even have the book in their possession at the time of their death. And so there was a lot of prohibitions around the book and getting it kind of banned in a lot of areas. And so a sociologist down from UCSD has coined this term, and this is something we've focused on for a long time in suicide prevention. That suicide, certain presentations on the topic of suicide may influence a vulnerable person towards suicide behavior. And so a lot of our efforts over the past 20 years around messaging around suicide have been focused on the media. Don't do this or people might die. If you use the word commit, if you don't put a research, be very, very careful, people might die. And that's honestly just a horrible place to try to get people to learn from. Because then people start freaking out, wait, if I don't do this, then people are going to die if I do this. And so over the last few years, we've been really more focusing on this, the Papageno effect, which is based on a character from the Magic Flute who is saved by some boys in the village. And what we have been focusing on more is that, this is going to be at the heart of our presentation today, is that positive messages around suicide prevention can increase help seeking. So rather than focusing so much on don't do this or people might die, let's focus on, hey, if you do this, people might live. And that's a lot more enticing to us to want to go to that realm. So that's kind of the framework that we're going to be working through. So looking at these statements, these are things that many of you have probably heard over the years. But what is the message that these statements are sending? How about 22 veterans a day die by suicide?
It's common.
It's common, right? It's happening all the time.
It's
How about
tragic.
It is.
Absolutely.
90% of those who died by suicide had a diagnosable psychiatric disorder. Suicide is 100% preventable. What message does that give you?
That you could have prevented it.
Right? Suicide is 100% preventable. So does that mean that my friend Jesse, who died by suicide, Does that mean that it's my fault that he's not here anymore? 22 veterans a day commit, aside from the word commit, and again, let's not get hung up there. 22 veterans a day commit suicide. Well, what if I'm that veteran walking down that hallway and I see a poster that says 22 people just like me are going to die today? Might that normalize suicide and think, well, if 22 people like me are going to do it, so what's the big deal? Or if I'm dealing with a mental illness and I hear that most people who have a mental illness, or most people die by suicide have a mental illness, might that reduce or reduce a protective factor that is keeping me safe? So we want to be very careful. Now look at some of these. What is the message that these send? You got support, right? There's something you can do, right? You can find the words. You can know the signs. You can reach out. You can be the one to save a life. And it's just a little tweak, and we're going to show you some of these images throughout the day today. But again, part of it is that we have to just think more carefully about what is the message that we're sending. Probably not time for questions yet, so we're going to skip that slide. Ellie and I are going to be fairly informal today, so as we have questions throughout the day, just raise your hand, shout them out. We'll take them, and then we'll try to save time at the end. Oh, right away.
Yeah,
Mr. Pine.
in the other room, you had said that the yellow ribbon type of presentation isn't something you recommended.
Yeah.
I just wondered if you could expand on
So
that.
I wanted to clarify, it's not that the yellow ribbon presentation isn't something that I recommend. It is the large format
Large
in a
format.
school setting. Because imagine being that kid who's thinking about suicide and you're crammed into a gym with 3,000 of your classmates. There's no ability to ask a question, no ability to reach out for support. So what we really try to get schools to do now is ideally classroom settings where there's an intimate relationship with that teacher. At the very least, a small group setting, maybe a couple hundred students, so that, and teachers present, counselors present. Obviously, there's just an efficiency that has to go with getting this information out. But I also think one of the issues, and I'm guilty of this because I went into a number of high schools, is that I would come onto a high school campus and it would be Suicide Prevention Day. And it was this big event, it was this big to-do. But what about all the other days that we're at school? And almost, I think we need to start getting suicide prevention filtered down to youth as simply a life skill. It doesn't need its own day. It doesn't need its own thing. It's just a life skill, like CPR, the Heimlich maneuver. It's just a skill, and I think the more that we do that, in my opinion, the more we're going to just normalize it as something that we all do. Yeah, this is what we do. All right, with that, I'm going to turn it over to Ellie.
So I'm going to tell you a bit about some of the national consensus guidelines around messaging that we've developed more recently. So the first thing to point out, of course, since SPRC promotes the national strategy, is there are 2 goals in the national strategy that are specific to messaging. And the first one really speaks to all of our communication efforts about us as messengers, sending messages that are designed to prevent suicide by specific knowledge, attitudes, and behaviors. The second one has to do with the media and the entertainment industry, and that's, as Stan mentioned, been a little more in our dialogue for a longer time. There's been a lot of focus on the news media in particular for a while. So this is the 2012 national strategy, our second national strategy. So we're going to be talking today, as Stan said, about public messaging, the messaging we're putting out into the public realm. This is the National Action Alliance strategic priority that I told you about in the keynote, and that also addresses the media and entertainment industry. So I think of that green area as the people who are telling stories, fictional or non-fictional, and I think of us as the public messengers, all of us, as the people who are sending out prevention messages and informing some of those stories. So we're going to be focusing on this today, except for a brief. California really has done really cool stuff with the news media. So Stan has a few things to tell you about that.
Because we're awesome.
So here we're talking about any public-facing information. And I think it's important to differentiate that in one-on-one conversations, in clinical conversations, sharing in support groups, as we heard in our panel, trainings for professional audiences. We have a trainer for the assessing and managing suicide risk training in the room that SPRC has been involved in. Those are different kinds of settings. That's not a message that's going out broadly to the world. But communication campaigns do go out and you don't know exactly who is seeing that message, your Twitter account is out in the sphere of whoever sees it. Your website, your newsletter in your community. So those kinds of communication channels might be seen by people who are struggling with thoughts of suicide. And we want to think about how they're perceiving that message. So there's a story behind how the National Consensus Guidelines came about. And in 2013, there was an expert panel that was convened that looked at a variety of different things. This report you see here on the right was an assessment of the 2001 national strategy, looking at how well it had been implemented, including what we knew about communication efforts. We also looked at the research literature. There'd been some studies around the impact of different kinds of messaging. We talked with diverse stakeholders, and we also looked at, I was on this expert panel, we also looked at public opinion surveys, because a lot of the messaging that our field has been putting out, or at least up to this point, had really been to raise awareness about the urgency of this issue, right? It wasn't on the public sort of consciousness 20 years ago. And we wanted to make it known that this was an important public health issue. This is something that can be prevented, and that we need action and funding to do this, right? So we looked at some public opinion surveys that showed us that there was a response to that kind of messaging. People generally across the United States, and in some specific states where there'd been surveys, knew that suicide is a problem at this point. So we looked at the current messaging and saw a few challenges, and Stan has already highlighted some of these. Because we were trying so hard to raise awareness that this needed to be addressed, this was an important prevention issue, a lot of our messaging was around how severe the problem is, those 22 a day. We wanted to highlight the tragedy, but we weren't really telling people what they could do to prevent suicide. So collectively, that was creating sort of this narrative of inevitability and sort of it's everywhere that maybe wasn't serving prevention as well. There were a lot of stories of loss, which are really important to share, but those stories, as we were hearing in the panel today, of living through a suicide attempt, of thinking about suicide, but finding reasons for living, those weren't out there. And then that we weren't really having a shared message. We were kind of all over the place in our messaging about suicide prevention. So we really want, as a field, to shape the conversation, to create a more nuanced narrative that the news media and the entertainment industry is telling. So this is the framework that the Action Alliance came up with. This was an Action Alliance group, and this is the guiding framework for messengers, all of us. We have other frameworks that we'll talk to you a bit about for the news media, and the Action Alliance is also working on developing some updated guidelines for the entertainment industry right as we speak. Should come out later this year. But this is really for us, and it has 4 elements that we should be thinking about when we are doing any kind of public messaging about suicide. And we're going to talk you through some of these briefly, and then we'll have you do an activity to kind of think about how it applies to your own communication efforts. So in the center is strategy, and that means a few different things. First, communication can't fix everything. A message saying, stop the stigma, may not change the stigma. There's a lot to peel back in the onion of stigma, or saying, talk to your doctor about suicide, maybe that isn't the answer if the doctor doesn't know what to say back. So is communication the right fit for every kind of problem or every prevention challenge? I did some work in a community in Massachusetts around mammograms. And so my background is health communication, which is why I'm super animated for this session. And they wanted me to produce a brochure that told women that mammograms weren't painful, but actually They are painful for many women. So that couldn't be our message. We couldn't fix that with communication. Maybe there were other adjustments they could make in the clinic to make it as comfortable as possible. But that wasn't something we could fix through messaging. A lot of people start with this kind of idea. We're going to make posters. All right, let's do posters. Or, wait, what was the thing that we were talking about yesterday? I've heard fortune cookies. Like, there are all kinds of cool, creative ways to get messages out there, and it's the fun part of communication, so we all like to start there. But that is not the place to start. The place to start is to know, who are the posters for? What do we want people to do? Why are we using, what is our message that's going to go on this poster? And why do we think that message is going to contribute to suicide prevention? So we've got to check ourselves and think about, what do we expect to happen when we put up this beautiful poster? Poster maybe isn't even the right thing, we might find. So there's also a large health communication literature that supports the importance of strategy. So these are some of the key characteristics of successful communication campaigns. They have clear audiences and goals. They're connected to your bigger program. So if you want someone to go see a doctor, you've trained that doctor on what to do if somebody comes to them. You pre-test with your audience. I have a funny story that I can tell you at the dessert reception about an experience with that where we thought a message was going to go over well and it didn't. And you also want to evaluate. You want to know, did it have the effect that you wanted it to have? So this is a busy slide. There are a lot of frameworks for communication campaigns, and that's what these on the right are representing. And you can find links on the framework website to those. But because the framework is for your social media account and your Instagram and your newsletter, and not always about a big public media campaign, these are the steps that the framework lays out in terms of how you plan. And note that the how to reach them, where you decide that you're going to do a poster, is step 6 of 7. So you want to think about, what's the context, why are you using communication, who are you trying to influence, what do you want them to do, what should you say to persuade them to do it, and then comes how are you going to reach them. So these are not actual campaign materials, but Stan showed us a similar kind of message just a moment ago. And the expert panel really was emphasizing we want to shift away from this awareness raising, which was important, but if most people know now it's a problem, what kind of action does this kind of poster convey? Also not a real, but even a prevention-oriented message. This doesn't really have any kind of audience in mind. It's hard to tell what the goal is, and it doesn't really tell you what to do. And I think the key point, this is like a flexion point where I think there is momentum, communities are engaged, people want to make a difference, and they kind of get that they can make a difference. So yes, but what then? So the Know the Signs campaigns tells you what to look for, how to engage in that conversation, which is a really tough conversation, and how to connect to help resources. It gives you those steps that you can take, practical actions that you can take for someone in your life that you're worried about. I've used the doctor example already, but this is actually based on a real campaign from several years ago. Treat depression, suicide is preventable, call your doctor today. That's a great message. It gives an action step, but again, if the doctor isn't prepared for the call, people are going to quickly decide that this isn't a real message. This is not a true message, and they can't talk with their doctor about it. So integrating with programmatic efforts, you want to think about communication as connecting to all the puzzle pieces of your work. And now I'm going to hand it back
Great.
to Stan.
Thanks, Ellie. And just to piggyback on that one, I'm going back to the school example, the assembly earlier. One of the things that we're doing, if you're not familiar, AB 2246, Assembly Bill 2246 is requiring all schools that serve pupils in grades 7 through 12 implement suicide prevention policies. And there's a spectrum that we talk about in the education setting. Well, for a long time, we were going in and we were doing a kind of similar campaign, student engagement. Hey, talk to an adult, ask for help, but then we weren't training the adults. And we weren't training the staff there on what assessment tool that they were using. And so now we've flipped the script completely, and I think it does kind of relate to messaging, because we were doing the messaging, we were getting to the audience, but we weren't making sure that when we did the thing that we wanted them to do, that the safety net was going to work, that the people were going to catch them. So what I want to do now is talk about a few of the don'ts, and I apologize, but we do got to hit on some of these. We got to acknowledge what are the don'ts so that we can make sure, because a lot of times, I mentioned it earlier, but there's this mentality in the mental health and suicide prevention field a lot of times, like we're all, I don't know, we're all fighting the same fight, and yet for some reason we're so quick to point out, like, look at what that person did. They got mud on their face and they screwed up there. They used the wrong word. They used the wrong whatever. And sometimes we have to look in the mirror and hold ourselves accountable. Another thing I would challenge you to accept is that not everybody a suicide prevention expert does not automatically make a suicide prevention messaging expert. There are two different components there. So don't just assume that people in my field know what the heck they're talking about. But what might cause a message to be unsafe? What are some of the things? We kind of tapped on them, but what are some of the things? What might make a message unsafe? Just back of the napkin, top of your head. Once again, this is the interactive part. Information about the methods, all right, yeah. And not only that, dangerous, but also traumatic. Every time I read an article about firearms and suicide, it gets to me. Anything else? Good, because we're going to talk about it. All right. So number one is that anytime we just have to acknowledge that suicide is a sensitive topic. Ellie was really a proponent, and as we all on the planning team were about, hey, we're having a conference about suicide. Anytime there's an event, a presentation, you've got to have support network there. Anytime we talk about it, and I have to also acknowledge this, that as a loss survivor, as someone who's been there, you know, with my own thoughts of suicide, like I have to also acknowledge that I may lose it. Sometimes it punches me in the gut and I don't see it coming. I can give this presentation 1,000 times, and then I recently was given a presentation in my hometown, the town where I grew up, the town where Jesse died, and all day long I was off, and then driving home from the presentation I broke down crying, and I had to pull over on the side of the road. I was like, man, I've given this presentation literally thousands of times. Why today is this any different? And so I called my friend and we were talking. He's like, you're an idiot. You're literally giving a presentation 2 miles away from where your best friend died by suicide. Of course it's going to be tougher. And so we have to always have that resource there. And so even if it's a positive, you know, thing that we're doing, we're promoting a suicide prevention awareness event, make sure that people have access to that resources, that when those emotions get stirred. Another part about resources too, just something that I think we miss a lot, is people think that crisis lines, hotlines are only for people in distress. They are also for the helpers of people in distress. We tell people, okay, ask the question. Ask people directly about suicide. And then they say, okay, I asked them directly about suicide. And we forget, well, what's step 2? If you don't know what step 2 is, contact the Access and Crisis Line. Contact the National Suicide Prevention Lifeline. Get help from a trained professional that says, well, let's do this. Let's follow up. But you always want to make sure that you're including a resource. Again, whether it's in a newsletter, in a post, in a news article. Avoid normalizing statements. So Ellie hit on this earlier, but when I first got involved in suicide prevention, we were screaming from the rooftop saying, hey, everybody, there's a fire over here. Come help us put it out. We did a survey through Know the Signs, and we asked people around California, hey, is suicide a problem? And everybody's already on board. We only get people's attentions for such a short amount of time. Why waste it telling them how often this happens? And these actually frustrate me, this every 40 seconds, because it's not like literally every 40 seconds somebody's attempting suicide, right? Somebody took the number of minutes, estimated the number of attempts, and actually manipulated the statistic to make it more dramatic, to make it that issue. But again, what if I'm that person who's thinking about making an attempt? What if I'm that person who's thinking about doing it? So one thing to also acknowledge, most people who think about suicide aren't going to go through with an attempt. There's obviously far more people who think about it than attempt, far more people who attempt than will die. But when we do this, we inadvertently remove that protective factor. And again, we're also wasting valuable time that we have with that individual. Don't convince people that it's an issue. Don't try to make this as a normal response to common life circumstances. One of the ones that I think is most frustrating to me is you'll hear that LGBTQ youth are 3 to 4 times more likely to attempt suicide. And there was a couple organizations that work with LGBTQ youth on mental health and suicide prevention. They had that on their homepage. But that's where LGBTQ youth were going to get support. And you just told them, just because of one part of you, you are more likely to attempt suicide. And then there's we're going to talk about it later, there was a guideline framework that came out that said, it's not being LGBTQ that makes you more at risk for suicide. It's the bullying, the discrimination, the harassment that can come. But that, to say that being LGBTQ increases risk is assuming that those people are experiencing that harassment. That's not true. Being LGBTQ does not automatically mean that you will have an increased risk of suicide. There are other situations and circumstances that come that might lead to that, but we just have to be very careful about how we normalize. So we hit on this a second ago, avoiding detailed descriptions. And I would encourage you, this, as much as she said this isn't for personal conversations, I would implore you to also include this in your personal conversations. Be just vivid of being aware of what is the value in the means and methods. If we're talking about means restriction, then yeah, let's talk about means and methods. But when it comes to the individual deaths, avoiding specific details about the weapon or how it was used. Robbins Williams' death was kind of the worst example ever of how that might look. That being said, there might be other situations like, I'm not sure if you remember Junior Seau, he's an NFL player who died by suicide. There's a lot of conversation about traumatic brain injury, and so when he died by suicide, his wound was to the chest instead of to the head because he wanted to have his brain. So in that was part of the story. That was a conversation piece, and so there was a little bit more leeway because it was pertinent to the story. But a lot of times it's not, and we just have to be careful that when we do that, when we have the location of the wound, the location of the incident. I was working with the school a little bit ago. They had a death by suicide in their parking lot. There was a set of boulders by where the student had died by suicide, and their school does yellow ribbon program. And so they wanted to, the principal said, well, why don't we paint the boulders yellow as a symbol of hope for everyone else? And I said, that's a great idea, except I guarantee you the next time you have a suicide attempt on your campus, it's going to be right at those boulders because you have now created a magnet. So sometimes things don't always work how we want them to. We talked about this, so I'm not going to spend too much time here, but avoid oversimplifying. Again, it's very rare that there is one thing. There's often a lot of other issues that are going on. But what we refer to as the cause is oftentimes simply the straw that broke the camel's back. And if we're to be honest, at some point, all of us run out of the capacity to deal with the stress. So rather than focusing on that, we're going to focus on some of the other components. So I mentioned a few of these earlier. We've kind of mentioned them. But there are guidelines. It's not just the recommendations for reporting. There's a number of tools out there. If you're not familiar, your organization has decided that you want to engage on social media. There's a resource toolkit for how to use social media for suicide prevention. You're not, again, we have a lot of tools. We've made a lot of mistakes in the past, so learn from previous mistakes and jump in there. And anything you want to add on the guidelines portion?
Oh yeah, just so that these are existing guidelines that can help if you decide that you're going to make a video, if you decide that you're going to do a social media campaign. There are actually guidelines out there on how to do that more effectively. And so this part of the model and this part of the website gives you lots of different kinds of resources, including, Stan was just mentioning, talking about suicide in LGBT populations. There's some population-specific considerations, but also some channel-specific considerations about how to use different outlets, communication outlets. So it's just like, it's there. You don't have to reinvent the wheel.
Yeah.
And some of them are not suicide-specific, but still can be useful.
Okay.
All right. So we've talked about strategy in the center. Stan just covered safety. The guidelines we're not going to get into today, but I did want to talk about the positive narrative. Because as I mentioned, this is a really core part of the strategic priority of changing the conversation about suicide prevention in our country. So here we're really messaging for prevention. We're messaging to increase hope. And it's not, I don't know if you can even see, I should have made it bigger. It's not kittens and rainbows that are gonna be credible, right? Suicide is a serious issue. The people who are thinking about ending their lives are experiencing indescribable pain, and a kitten isn't going to convince them that suicide can be prevented or that they can get through this. So, instead of trying to, I don't know, not whitewash, instead of trying to paint a rosy picture of what things are like, we want to talk about what do we know about suicide prevention? What can people do to help those they love, help their friends? We want to tell stories of people who were helped, of people who found hope, of people who found reasons for living. The image at the right is the Make the Connection campaign from the VA, and that has so many different stories. You can pick your gender, the conflict you fought in, the service that you were in, and you can find someone like you talking about their experience struggling with suicidal thoughts and seeking help at the VA and how it helped them get through that experience. You want to provide those concrete action steps, and you want to make sure that it's not too much. Suicide prevention can feel very overwhelming for sort of a regular person. I'm not a mental health professional, for instance. It feels very scary for people, but if you can, like the Know the Signs campaign, give people some examples of small steps they can take that are realistic for them and accessible for them, and that we know will help the person they're concerned about. That is what we want to focus on. And we also want to tell stories about our successes, our prevention successes. So instead of talking about how many people are dying by suicide, could we talk about how many people are calling the crisis line? Could we talk about the story of the teacher who was trained and then the next day spotted a kid who needed help and was able and knew what to do to get that kid help? So I think there's a lot of different kinds of stories that we could tell, and we are the people who know those stories. We're the people who know the stories of hope and prevention. And so we also can be conveying that to the news media, helping the entertainment industry to find examples of those kinds of stories. And now, Idaho recently put out a PSA that I really thought kind of modeled some of these elements.
That's our agenda today, so you guys be safe out there.
Our job is to save lives. That day,
Let's go talk.
Carlos saved mine.
What's going on with you? I don't know.
After my husband left, I was going through a really rough time.
There's missing info in this report. It's not like you.
I know, I'll redo it, okay? I think everyone noticed, but Carlos decided to act. I'm here today because Carlos connected me with our employee assistance program, and I got the help I needed.
Everyone has a role in preventing suicide. Know the warning signs and rock your role. If someone you know is in crisis or emotional distress, call the Idaho Suicide Prevention Hotline at 208-398-HELP.
So they have a series of different kind of scenarios, but I thought it was a good example of kind of showing somebody doing something accessible, a simple action that helped, and also, as we heard in the panel today, noticing that something seemed off about his colleague and then reaching out to see if things were okay. All right, so we have made it through all of the elements. So I want to pause here because I don't remember what the next slide is.
I think we're going to get into the activity in a second.
I think the activity is next. So how does all that sound to you guys? Do you have questions? What's on your mind? Thinking about your own public messaging in your role.
Or one of the activities that you did here in LA County around mental health was We Rise. You know, like how empowering to say like we rise instead of, you know, focusing on the negative. You know, so it's so easy to to get focused on the bad and turn that conversation. But what questions do you have for us, or what have you been part of efforts that have been, good or bad, that you're like, oh man, we really missed the mark on that looking back, or hey, what questions, what insight? Yeah.
Well, our school is rolling out suicide prevention and awareness month, like all month, and we're
What level of school? Just
high school.
okay.
And so, similar to what you're suggesting, we're doing it. Each classroom teacher is presenting a presentation created by the mental health team. That's like they're speaking through it, but it's like we're now going to change a little bit. But I was wondering for the last of kind of like once we teach these students like how to identify the signs, what would you recommend telling high school students to do if they are seeing signs within their students? Like what would, like 3 takeaway things that all students could do? Like obviously connect with an adult, but a lot of them, like, what would you provide sentence frames for them, or, cause like they're young.
I can go.
Yeah.
Do you want me to go?
Sure, you can, and then I might have something to add.
Oh, you can add.
No, you say.
Okay. Well, I think, again, it's about advancing the message, too. Like, for years and years, we've been telling kids, tell a trusted adult. It's okay to ask for help. But sit down, have them write out 3 adults. We do the safety planning intervention for people who have been identified at risk. Like, I don't see any reason why we can't do a safety plan for somebody who's not at risk before they get at risk. Identify for the kid, who are 3 adults in your life that you could talk to. There's always been this research having one adult connection. And maybe it's not your counselor, maybe it's not your teacher, maybe it's not your parent, maybe it's an aunt, an uncle, a coach, someone who lives down the street. Also, I think, we know that most youth who go on to attempt suicide will tell a friend, but that friend doesn't go on to tell an adult. So it's helping them work through that process. And really, I think, kind of like what Ellie was saying, like simplify the steps. Like, what does that look like? I'm going to share a film with you from Directing Change here in a little bit that demonstrates a kid recognizing risk and then walking that friend to the counselor. So that's at least one point that I would want to make, is really getting them to think through, what does that look like?
Sorry, that's my ringtone. I was like, oh, I thought I silenced my phone. I would also say what Stan said earlier. We do want them to talk to a trusted adult. Are all the staff and teachers in the school prepared if a kid does talk to them about someone who might be at risk? Do they know what to do? So there is a toolkit that SAMHSA put out on high school suicide prevention that articulates exactly what should be in place for prevention and postvention. We also have a postvention toolkit all on our website. So I just, like, how is it baked in throughout the school? Because if you want to tell a kid to talk to a trusted adult, and we all, or at least the intuitive reaction when somebody says, I'm thinking about killing myself, is to say, no, you're not, right? How are the adults prepared to respond? And there was something, we also, there is some literature that's probably a bit older at this point to suggest that one of the reasons that kids don't tell an adult is because they have this idea of being whisked off in a straitjacket in an ambulance and kind of imprisoned in a mental institution. So part of it has to know with, is that the expectation in your school? But there might be some clarifications of like what will happen if I tell a trusted adult. So again, like knowing your audience and knowing what their barriers are. But certainly I'd say that their scripts are helpful for how could you ask the question. So the Know the Signs campaign has specific conversation starters. And then the last thing I'd say is there is the crisis text line, which isn't part of the National Suicide Prevention Lifeline, but it is a resource that might be more accessible to young kids. There is a chat service with the Lifeline, but not, they're always texting, so, yeah.
And I think one of the things, and I know we've had this conversation, but for schools, we tend to always focus trainings on our credentialed staff, our teachers, our administrators. We need to start training the whole school.
Yes.
We don't have enough conversations with the custodian, with the cafeteria manager, and so we really have to get away from that. For years, schools really trained teachers, counselors, administrators. So we have to step out of that box and start to look at everyone who's on the campus.
I think that's true, and that's also true in healthcare settings. You know, we train the doctors, the nurses, but then what about the front office staff that actually has that banter, that knows when the appointments have been canceled and the bills are past due? So I think that can be pretty consistent across. Susan, did you have something? I know you didn't.
Yeah, can you just speak briefly to the challenge if you're doing public presentations more related to suicide and grief and the experience of having lost someone to suicide? Because in having done a number of those, yes, I do include things about what was healing to me and you know, what was healing to other people around my son's death, but I want to convey to them how it felt.
Yeah.
And to gloss over that and not, you know, like I've heard someone did a webinar about this and said, oh, it should be 70% positive and only 20 or 30% about the despair and the pain.
Oh.
Do you want to comment on this?
I don't know. I would say you got to meet people where they're at, and telling lost survivors kittens and rainbows is not.
Not just lost survivors, but other people who want to be able to help lost survivors.
Oh, okay.
To understand their experience more. So if it's general public, some of the folks there are going to be lost survivors and some.
I guess, I don't know if you have a response. I guess I'm getting lost on the question.
I'm sort of,
Positive.
as that's provoking my question, which is there a program for training adults, teachers, whomever, about how to respond when somebody comes to them and says, you know, my friend is talking about suicide? Is there any kind of simple training, or do we? I mean, I can imagine one. You know.
Yeah.
But, yeah.
Yes to that, and then I don't know. Maybe you can answer Susan's initial question.
They're actually TAPS, which is an organization. Okay, so for the rest of you, an organization for folks who've been bereaved by the loss of a loved one or family member who was in the military. They have done a lot of work with survivor members around this issue of, we want to focus on prevention and hope, but we also want to tell our story of loss. And they are working on a resource that should be ready soon, actually, that we're hoping to translate for more broadly for suicide prevention audiences. But I can share my card with you and maybe make an early connection. I think they're doing a webinar on it today. But it is a careful line to walk, because there are reasons for sharing your story that are personal, and there are also reasons for sharing it with a public audience. So you want to sort of have your objectives clear and make sure that you're kind of meeting your own personal needs and sort of leaving the audience with your message. So it's very delicate. And I think the thing about the positive narrative, it doesn't mean that everything has to be positive. Suicide is a terrible, tragic event. And we're not trying to whitewash that or ignore it or gloss over that. I think the point of this framework has to do with, so then how can we make it better? And I think as long as you have that in your talking points when you're sharing your story of loss, you have a unique perspective as a loss survivor. You have some ideas of what might have helped your loved one, or what could help others who might be struggling. You have a unique insight. So I think that's really important for people to hear. And it doesn't have to be the positive narrative. Maybe I would frame more as the prevention narrative. Like, we want to tell stories that will help others. And I think that is every person's intent who shares their personal story of loss. I'll stop there.
Okay.
There are a lot of resources for schools. And it's not just training, but like kind of baking in the policies. Like, every teacher, every coach, every bus driver, every cafeteria worker needs to know what the signs are and what to do about it in your school with your resources, right? So you really want to think it through and plan ahead.
Maybe this is a given for everybody, but I think sometimes like training the kids too. You know, having the students, even younger students, be involved in what is the plan in the school, so they understand that.
Sure, yeah.
Because a lot of times I think kids don't come forward because they don't know what's going to happen, or they don't know who to go to. There's a bubble sheet that isn't willing to send anybody that not. It's like a my survival kit, and it's got a bunch of bubbles on it that
Yeah.
you're supposed to put yourself in the middle, and if you were in trouble, who were you gonna reach to first or go to second or whatever.
That's a great.
And we did it with a group of middle school to high school kids, and it was really interesting because parents were there and they were like, wait a minute, why is my name like falling off the edge of the page? And who is this person? You're going to tell first. And most often, as you said, it's going to be your peers first that you'll tell. So to not prepare the peers is really, I think, the biggest mistake we make sometimes.
Yeah, not
Absolutely.
asking the
That's
youth their opinion on what social media platform the youth at the school are using and stuff like that.
Or the kids will say right out loud, like they were like, well, we know this teacher will help us, but won't necessarily press like the panic button. So they know like who's going to respond in a certain way.
Yeah. Who's going to press the red button? Yeah, in the back, and then we'll come up front.
I'll try and make this really quick. I'm a filmmaker. I'm making a documentary about depression and suicide, so I'm not in this world in the way everybody else is. But my personal experience in LA, my step-grandson was in grade 8 at Buckley, and in February, one of the students died by suicide. And I have to say, the school was unbelievable. They got people from the hospitals in. They got all the other schools sent counselors over. Every single kid the whole school was spoken to. And I spoke to the head of and because my grandson got the last text that this young man sent, he was really pulled into it, and the police took his phone, and it was this whole world of learning in a very sobering, tragic way what can happen. But the school was amazing in their response, and I spoke to the head of upper school, and he said, we haven't dealt with this. And I lost my mother 40 years ago to suicide, long before postvention existed. And I sent them a case of a book that I still find helpful all these years later. It's called Touched by Suicide, Hope and Healing After Loss by Michael Myers and Carla Fine. And it goes through loss, depending on who you lost, because it's different whether it's a parent or a sibling or a colleague or a child. But I sent them a case for the library, and I've since heard that it was helpful for people to have somebody, just be able to read quietly about somebody else's experience. So that was one thing that was really helpful. And the other one was Bill Styron's book, Darkness Visible.
Oh, yeah.
I think a lot of people have difficulty believing that anybody understands how they feel when they are severely depressed and or suicidal. And my experience, both personally and with other people, is that sometimes hearing somebody else's experience and understanding that somebody else has been there. But that book, to me, doubles so many people who nobody writes about that space because they can't usually, in my experience. But that book has been really helpful and is also a great resource for understanding where people can be when they are desperate. So thank you, LA, for all of the help you've provided to these schools and all the work you do.
What was the first book that she said, Myers?
Touched by Suicide,
Myers.
Michael Myers and Carla Fine.
Not the Michael Myers, the different one, right?
The other one. The one
Up here,
more.
Michael Pines, and then
Yeah.
we're go
We
ahead and move
probably
into the
should.
activity. Yeah.
This week, I had a new private practice client. He's 13 years old. And he disclosed to a teacher that 3 days prior he attempted suicide, and he stopped himself. But there's a stigma at his school. It's a private school. He's not allowed to return to that school.
Oh, no.
And our attempts, if law enforcement comes to a school to evaluate somebody for risk, they may oftentimes they'll end up putting that person in restraints. There's a lot of
Oh, yes.
stigma. So in addition to dealing with the issues, this kid's a survivor. He survived suicide.
Yeah.
That's a positive thing. He reached out, but he's being flooded with a lot of negative stuff now because it's out there. And
Yep.
so that compounds his struggle.
Oh, absolutely.
I like what you did just there when you said he's a survivor. You know that because
I'm
just
talking to people, so they're here alive. Right?
Yeah.
Yeah.
So maybe they've got those other things going on, but
But it's
But we
those little
need to-
tweaks of emphasis that
Yeah.
can go a long way. I think we need to move on. Just because we want to get to the activity. and
Are we
then-
still ending at noon?
I have no
'Cause-
idea when we're ending. I think we're just talking. I'm guessing we're going to go till 12:15. That we still get
Okay,
the full
all
90
right.
minutes. That's my impression. So
Why
let's
don't we
do
go
the
with
question.
one more question and then we'll.
Oh, well, thank you. Speaking of what we're talking about, my son's been in and out of a lot of psych wards, and not necessarily always for suicide, but I think a lot of times substance abuse is a form of slow suicide.
Yeah.
And co-occurring disorders makes it so much more complicated. There's so little treatment for that.
Yeah.
And also, the experience that most people have in these hospitals is not good. There's not much caring. It's all perfunctory. It's sort of like a conveyor belt. Okay, the doctor says, "Are you suicidal today?" "No." "Well, you're out of here." And it has nothing to do with the truth. And it does stigmatize and it causes trauma forever. Are you guys doing anything about what happens when people do get 5150? And, I mean, I really think that's important.
Yeah, I do. That is a very loaded question, heavy question for a messaging workshop. But I will say a few things. One is that by better training law enforcement officers, school counselors, nurses, doctors, to be able, the better we train non-mental health professionals in risk assessment, the better they're going to be able to figure out when do I press the red button and get this person sent in for that follow-up assessment. But to bring it back to messaging, I think part of that too is also that a lot of people think that when their family member gets put in on a 5150 hold, when they get that person back in 48 to 72 hours, that person is going to be fixed. So it's also, I think, to relay back to messaging, we can also communicate better so people understand what to expect from that 48. That 48 to 72 hours is also in large part to give the family an opportunity to circle the wagon. So again, I think it comes back to communication. I'm gonna bring it back to communication because I think we have to have better communicate about what to expect in those settings. And hospital settings can do that by having programs like NAMI has a program, Friends in the Lobby, where they communicate with family members about, hey, this is what you can expect. So I know I didn't really answer your question. Can we do better in treatment and care? Absolutely. That's just not.
And I can tell you more about some initiatives on the transforming health systems side that I think are where we want to get to, is sort of kind of getting there. So this room is not set up ideally for a small group exercise.
No, so we're just going to make a mess of it, but we'll do it. I think we can do it.
So should we divide them by rows?
I think we should divide them by sections. I think we
Okay.
should divide down the middle. Well, we got 8 seats, so I'm gonna draw the line right down the middle
Okay.
of the room. So everybody in this row on this side, raise your hand, so we know where the split is. Jewel and everybody, just this row. All right, or everybody on this side. Everybody this side of the room. All
Right.
right, so we got the split there.
Okay.
So what I'm thinking we
then
do is do rows of 2.
2, 2, and 2.
So you two are team, you 2 rows, you 2 rows, you 2 rows. And actually you in the back will just be one team. And we'll do the same thing on that side.
All
So
right.
you can turn around, you can turn your chairs, but don't move yet because Ellie's going to explain what it is that we're doing.
So we're just going to ask you to talk about a particular population. We are going to assign populations. So we have 5 different groups that we'll ask the different groups to focus on. And for your assigned audience, we've already answered the first question. But we want to think about, for suicide prevention in your community, what would you want this audience to do? How will you reach them? And how will you know if you're effective? So it's a real quick activity to try to bring some of the strategy thinking to some audiences that are more or less familiar for you. So are you going to assign the audiences?
Yeah, I'm going to assign the audience. So
Okay.
this group here is going to be parents of middle school age youth. This group here is going to be homeless female veterans. You can have that one too. Don't worry, it's okay. Immigrant agricultural workers right here. The row in the back, since you were so excited about it, you're going to be homeless female veterans. That group on that side, caregivers of older adults. The group on this side, those 2 rows, thanks Ellie, EMTs and first responders. And that group up there, Ellie, you can pick it. Which one do you think? We got 2 homeless female veterans.
Do you guys want to pick? You guys can pick. You guys pick. You're the only group that gets
You're the one group that gets to pick.
Parents.
That's what
We
you get
thought
for sitting
everyone
up
would
front.
choose parents. That's
All right,
why
so I'm going to go confirm the time on the workshop ending. For now, let's plan on 10 minutes for this activity.
10 minutes, and then pick someone to report out because we'll ask you to share.
Yeah, and again, you don't have to get too detailed. This is more big picture, but don't go straight to which poster you're going to create, who's your audience, how are you going to reach them, these questions. So we'll take about 10 minutes and we'll bring it in and wrap it up. We're going to wrap it up and talk about, so we're going to go group by group and just, because there's a few of the audiences that 2 different groups have. I think maybe only one group has EMTs. But we're going to start and just work our way through. So parents of middle school age youth, which groups had that? You all had that?
Yes.
You all had that? Anybody? Was that only 2 groups? Mm-hmm. All right, so you know who your audience is. You got parents of middle school age youth. What do you want them to do? What do we want parents of middle school age youth? What is the action item?
We wanted them to talk to their kids
About what?
about their mental health and suicide.
Okay. What did you all come up with?
We wanted them to, and we talked about different ways to reach them, but we wanted them to become more educated in warning signs
Okay.
and then reach out to other parents and spread the knowledge.
Oh, I like that too. So not just keeping it contained in yourself, but there's a secondary action item. Now spread the word. I like that. Yeah.
Actually, we had another point on that, what we wanted to do, kind of around languaging. We kind of stumbled on it, of using
Okay.
the S word. That would be another great takeaway for parents to actually have some training around how to really not avoid using the language around suicide. And kind of trying to do a little bit of a culture tweak there within that whole thing.
Okay. I like that. How will you reach them? How will you get that? How will you reach them to use the S word? How will you reach them to talk to their
It
kids?
almost sounds kind of weaselly, and I felt this way. when I
Weasley,
was-
all right.
A little weaselly. And a little sneaky. Is that in my county's efforts around family engagement, we basically will load in mental health into another facilitator's agenda, so we don't lose anybody. Because I know that if I'm able to have that conversation, I'll have that conversation, but I don't know if people will show up if I'm gonna, bill it as suicide. So I tend to follow other people's coattails. So that's typically how I reach out, through other family engagement efforts.
For example?
If we're having a parent engagement activity around how do we deal with some of the challenges of parenting middle school students.
Okay.
What I'll do
that's
is
smart.
we'll work on it. We'll talk about some of the challenges. We'll engage the group to kind of share some of the challenges of being a parent of a middle school student. We'll talk about supports, and then we'll talk about what those supports are helping to support. Some of the other side of that, mental health issues, mental health challenges.
That's smart.
So we do a similar devious effort down in San Diego. We actually replicated and there's a toolkit. So Know the Signs is a Suicide Prevention Week toolkit every year. One of the components of that is I worked with my home district, Poway Unified. We do an event called What I Wish My Parents Knew. And so it's an event that focuses, it's all around mental health, but academic pressure, communicating with youth, suicide prevention. I do that workshop. But just, again, it's about marketing. I would, if you have 3,000 kids in a school and you do a suicide prevention workshop, you got 2 parents to show up, and those are the parents that don't need to show up because they showed up. But you do What I Wish My Parents Knew. We feature, like I co-present with a student. We survey the students. So there's a lot of other ways that we can engage parents. So great job. How about your group?
We talked about reaching them. We had a similar conversation around only a few parents showing up, but we thought that using those few parents who show up as leaders on the school campus, almost creating like a phone tree or texting web or whatever, to be able to, we kind of teach those core 10 or whoever is the active parent, and then they create a strategy of how they're going to go out and engage the rest of the parents. So those parents that work, maybe it's giving them a phone call, and it might look different for every family, but at least it's their goal to reach a certain amount of parents, either via phone, via smaller groups, going into their home, whatever it may be.
I had a middle school one time. I did a parent presentation. They offered extra credit to the child if the parent showed up to the training.
Oh, nice.
How you'll be successful.
So you want to ever get a flyer home to parents? Offer extra credit. I'll turn it over to you to go to the next group. Oh wait, no. How will you know if you were
That's
successful?
an important question. So what would success look like? Either.
We were going to survey parents to find out if they felt more equipped to talk to their kids.
Okay.
Oh, cool.
So we have two kind of sneaky strategies using token economy and kind of surveys as well. So at a lot of schools, parents have to get service hours. They're very hard to complete. So if they engage in those conversations via phone with the parents, then they get those service hours.
Okay.
And then maybe their students would also receive extra token economy to spend in the student store or whatever it may be. So it's highly incentivized for the student and the parents.
All right.
That's really creative. Great. Okay, I think we also had two groups that were looking at homeless female veterans, you guys and the group in the back, right? So what did you want them to do for suicide prevention?
So one of the things we wanted them to do was to know the signs so that they might be able to recognize it in themselves, but also to be able to help each other.
Okay.
We wanted them to be able to know where they could go and what they could do when they were feeling this way. So it sort of got a little confusing for us because the resources are also some of the other places that we would want to reach them. They're also the resources.
Mm-hmm.
So we would need to educate everybody that we were going to be sending them to. So
Great
that
thought.
they would be aware. So, because they're homeless street outreach workers, because they're going to talk to folks individually.
Mm-hmm.
And then we know that missions, libraries, shelters, veteran service organizations, community organizations, those are places that they go when we want to be able to, those are the resources as well as places that we want to also leave things that also make the female veteran know that this is a place she can go to, but it's also a place that can help her. I'm getting confused here, but
No, that's
Very
really
good.
good.
targeting to make them aware of the resource, and it is also the resource at the same time.
Got it. That makes sense. How about in the back?
I was going to say that we had those discussions as well. I think the other piece that has been brought up in our group was that recognizing that the women most often don't self-identify, so it's about getting them to self-identify, seek help, find the services that are available. It won't necessarily be the VA. Many of them are survivors of MST, military sexual trauma, which ends up culminating into extreme case of PTSD. Oftentimes they get out with less than honorable discharges, and so they don't feel like they're veterans, even though the VA's laws and resources have changed and will allow them and will give them services. So it's about doing that. It's about reaching out to them in a language so that they recognize who they are.
So I like that you guys connected awareness with them seeking help. But I also think you touched on what you call in the communication field secondary audiences. It might not be reaching out directly to homeless female veterans with your communication campaign, although that is one strategy, but also making sure that the people who are interacting with them know how to care for them. Maybe trauma-informed care is appropriate given the facts that you just pointed out. So there might be communication efforts, just like with parents of middle school kids. We're really trying to reach the middle school kids, right? You guys didn't actually talk about the parents' suicidality. So there are secondary audiences, and sometimes that's going to be targeting the helpers rather than the people who are in distress can be a more effective communication strategy.
And I didn't talk about how we were going to reach out to them, because we had talked about creating business cards or pocket cards with resource information, working with the American Red Cross because they developed hygiene kits for homeless programs.
Oh, excellent.
So putting information in the hygiene kits, working with the
putting information at bus stops, working with peer groups, Women's Center, Downtown Women's Center as an example, outreach workers, suicide survival groups, the first responders, homeless stand-downs, which are veteran stand-downs for events that provide services to homeless veterans. And
Excellent.
oftentimes even the non-vets will show up because they don't ask them for identification. You just receive all sorts of services through that.
That is really great. How about you guys? How are you going to reach them?
What kind of, yeah, through
Or
the
was that
research.
through
Yeah,
the
that-
helpers?
She kind of did one and
Okay,
two.
okay, gotcha. And how would you know if you're successful?
Well, one of the ways, we talked about talking to those organizations that we have outreach to see if the women are coming in, really talking to them. We may give those organizations surveys. One of the things, talking to the women themselves, because the outreach workers are on the street with the women themselves. We also sort of had a little, so if there are fewer female vets out there, we know they're getting services. Not necessarily that they were suicidal, but that they were getting services. And so if they, and if those services were aware, then they were already connected to something, and those folks would be able to work with them when they were feeling more suicidal.
That's great.
Works for me.
So, and I think, again, we talked about similar processes, tracking the number of that have signed into VA for treatment, tracking the numbers that were identified, coroner's data as well as the state data tracking system. We know that also that women veterans are 30% at greater risk of committing suicide. Again, I apologize.
No, you're fine.
Committing suicide than their civilian counterparts. Significant higher percentage. And so tracking death by guns.
Yeah.
That's really great.
And that was, when you said 30% higher, I wanted to clarify that point. So 30% higher for death rate, or because of the capacity for firearm use is increased in the veteran population. Got it. Interesting. I just want to be cognizant of time, and I feel bad. I really want everybody to report out, but I also really want you to eat lunch. 1 minute. I gave you the 1 minute sign. 2 minutes. Laney's giving me 2 minutes. Will you forgive us if we don't let every group report out? Again, it wasn't so much about reporting out, it was about doing the activity. Is that all right, strategy?
I'm fine.
All right. Sounds good. Oh, wait, don't go. I still got 2 minutes. Resources. So hopefully you're familiar with the Know the Signs campaign. If not, again, our English and Spanish versions of the website. But when communicating, I just want to make sure you're all aware that through Know the Signs, through Each Mind Matters, we have materials that have been culturally adapted to reach a number of communities. This is just a taste of it, but again, culturally adapted, not just translated. They go through a whole focus group review process. A number of campaigns, again, in a variety of languages. So you can go to emmresourcecenter.org and you will see a filter of languages, of target audiences, of which just spend some time on EMM Resource Center. You're welcome to contact anybody on our team if you're saying, hey, I want to reach this community. I'm looking for a resource. More than likely we'll have something that can support you. Yeah, that's pretty much all we have time for. I could go on and on and on about resources. Go to Know the Signs. I didn't get a chance to show you the film, but hopefully you'll get an opportunity to see Directing Change. For those of you who work with youth, have youth, please promote the Directing Change program. And we didn't get a chance to talk about media.
There's free DVDs that you can pick up.
Yeah, go grab a DVD. Thank you. We didn't get a chance to talk about media, but we told you we probably wouldn't. There's our contact information. So enjoy your lunch. Thank you, everybody, for being here. Have a good day.
Thank you.